Brown spots and blotches on the face are the most common facial discoloration, but they can occur anywhere on your skin. There are many different types, and most are easy to fix. However, some prove to be challenging to improve, and others even defy many treatments. What about yours? Stay tuned. Hello, I'm Dr. Neil Schultz, and welcome to DermTV. No matter what your ancestry or racial background, virtually everyone is susceptible to varying degrees of tan or brown discoloration anywhere and everywhere on their skin. Our previous DermTV episode discussed age spots, also called sun or liver spots. But today, I'll put into perspective the entire spectrum of brown discoloration, and to simplify it, I'm not talking about moles or beauty marks today. In short, all brown discolorations are caused by your pigment cells, called melanocytes, making too much of your normal brown pigment, which is called melanin. Those cells normally make melanin all the time, and that melanin is one of the 4 pigments that are responsible for determining your normal skin color. But when melanocytes make too much melanin, you get brown discoloration. And the reason that happens is usually in response to some type of an injury to your skin. When the brown discoloration is in response to an acute injury like a cooking burn, a scratch, a pimple, a picked pimple, or a sunburn, it's called post-inflammatory hyperpigmentation, or PIH for short. Post means after. Inflammatory means inflammation, which occurs as a response to all injuries. And hyperpigmentation means too much melanin pigment, which is, of course, brown. So with most of these injuries, the area that darkens or turns brown is the same area that was injured. Round spots from pimples, linear areas from burns from the edge of a pan or pot, or even the shape of a scratch. And of course, your tan after a sunburn occurs everywhere you were sunburned. This type of PIH is easy to treat. Age or sunspots, which come very gradually over years and are round, but often with irregular borders, are also from a skin injury, but in this case, it's chronic and repeated UV injury over many years. It's the same bad UV rays that cause premature aging and skin cancer, and these spots are easy to treat. The last brown discoloration occurs in women and is blotchy, irregular tan and brown patches that occur most often on the forehead and cheeks, upper lip, and chin. It's called melasma or cloasma, but if you're pregnant, then it's called the mask of pregnancy. And this discoloration is very tough to treat. The bottom line is, if you have brown discoloration, as you can now see, it's usually as a result of a skin injury. And now that you know the type, check out the DermTV episodes on each to learn about treatment. One thing is for certain, though. Sunscreen will help the treatment of every single one. Please join me again at DermTV.com. If you have a question, please send it to me by visiting DermTV.com/question. I'm Dr. Neil Schultz, and thank you for watching today.